Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next hour or so discussing some of the programs that can enhance your ability to not only sell during this hectic AEP time period, but also keep the business that you're putting on the books by ensuring you're doing everything you can for your clients. I know that sounds a little bit naive in saying to a degree, but part of what we want to do with these governmental programs is make certain that we are maximizing the value of the products that we sell with an overlay of assistance programs from the government. Today's presentation will actually have a couple of presentations on LIS and MSP that you can use in presentations. There's a couple of tweaks we would have to do with them because I will show them to you today in basically a manner in which to help you understand some of what we're going through here and how you can relate that to your prospects and clients. Today's presentation is being recorded, and once it uploads, it will be made available on our website at premiersmi.com and on our YouTube channel as well. For those of whom RSVP'd for today's presentation, you will also be receiving an email with information about today's program, including a link to that recording. And so you'll notice in the software package that there is a section for both questions and chat. We ask that you use the questions section for things that come to mind as we go through today's presentation. But generally, we find that most of the questions are answered through the course of the presentation, but we'll make certain that you have the information you need to be in the loop with these concepts. Some of the things that we should start out with at first, for those of you who may not be as aware of who Premier is, we are a national marketing organization founded in 1968. That's part of the Integrity Marketing Platform with offices across the country. We're contracted in all 50 states. We all act as an insurance wholesaler working with independent agents such as yourself through contracts that are at the highest possible commission levels with recruiting contracts available to those who qualify. It's done through a full portfolio of products aimed at the Medicare market. So that includes many of the Medicare programs such as Medicare Advantage, Medicare Supplement, and standalone Part D prescription drug programs, but also includes a full portfolio of life insurance and annuity products, including final expense life insurance and pre-need plans, long and short-term care programs and disability income plans, and those ancillary benefits that are necessary for many people in our target our target demographic. I need another cup of coffee there, evidently. And that includes dental, vision, hearing programs, critical illness cancer plans, hospital indemnity programs, accident plans, and even telehealth programs that we offer through MD Live. The Medicare Advantage programs include the national carriers and many of the strong regionals that can make a difference for you in your market. And we have the ability to plug you into these systems across the country with local management with these carriers. The prescription drug programs follow that same train of thought, where the national carriers are there through our organization, many times with the same contract that you have for the MA programs. Medicare Supplement Plans, a very robust portfolio of products available here, carriers across the board that can help you with the higher income demographic in many cases, and also are supported by different marketing and technical programs that can help you be very proficient in this area as well. When we speak the ancillary product in each of those categories, the national players are there for you and include, once again, marketing systems to utilize programs that can be used that not only as another stream of income for your agency, but to fulfill that specific need that your prospects and clients have that aren't covered or covered to the degree that is necessary by the base medical programs. When we speak of the Medicare programs, obviously, everyone talks about the aging of the baby boomers, the silver tsunami, people aging into Medicare. But if you're looking at Medicare based just on age, it's a little different number than what we might think because, hey, a number of folks are working past the age of 65, not accessing all their Medicare benefits when they're first eligible. Some of it dictated by the pandemic, some of it dictated by economic realities, some of it dictated by the fact that, hey, as the younger of the baby boomers age in, you have to wait longer to get full Social Security. So there are a number of factors that come into play here, but that's more than made up by the fact that 15% of the Medicare population is under the age of 65, accessing the benefits through disability of one sort or another. So we need programs that can help people in this demographic because, hey, 2/3 of them have 3+ chronic conditions. They have some challenges with their income and assets, and having programs that are set in play that can help with these expenses can make the world of difference to the population. And we'll see in just a minute how, because it'll affect each of the areas that people have with choices that they have when they come in the Medicare program. They don't have to do anything. I had a manager years and years ago with Prudential that used to say the decision to make a decision is a decision. And that's true. So folks can actually decline the Part B with Medicare if they choose to do so. Thankfully, not many do. But some of them will then self-insure for the medical portion, pick up a Medicare Part D program, the prescription drug plans to help with those expenses. Some will look to offset some of the cost of medical expenses through a standardized, modernized Medicare supplement plan. And those that are at the higher of the low income can still be affected by the need for assistance on their prescriptions, in many cases, to maintain that premium for the Medicare supplement. And then, of course, you have the folks that go into Medicare Part C, the Medicare Advantage plans, where the benefits are bundled in many cases, and the medical expenses are assuaged by those benefits, but the integrated prescription drug benefit then is affected by the programs that we'll discuss today in detail, the LIS, Low Income Subsidy, Extra Help Program, and the Medicare Savings Plans, the MSPs, that can help them qualify more fully for different MA plans that are out there. You'll see that as folks come into Medicare, not only the folks that are aging in and taking advantage of the benefits immediately, but those that are what is being referred to by death research as late to Medicare seniors, you're seeing a pretty even split in the past between the Medicare Advantage and Med Sup programs, with a portion staying in original Medicare. Original Medicare can mean a number of things in this category. One of the things means, hey, they might be a dual beneficiary, get Medicare and Medicaid and fit in this category. They may be folks that are accessing medical benefits through the Veterans Administration with VA coverage, or it may be folks that have retirement plans from where they used to work. And then, of course, the folks that have original Medicare only. What we saw over the last year, though, once again by deaf research, is those numbers here got skewed a little bit, where a larger number of folks went into Medicare Advantage than Med Sups. So we see some things trending in that area, with Medicare Advantage really gaining some market share. Does that mean it's perfect for everyone? No. We have to make certain that we do an examination to help people in delivering the information they need to make that decision. And sometimes that means translating some of the information they get. So one of the things that you have as part of the follow-up today will be a link to this tool from the Medicare Learning Network that helps you with an acronym guide. It's always nice to be able to speak the language, and we find that in all parts of our society, any subgroup has their own little acronyms. So this is going to help in that particular area. We are, of course, in the annual election period now that starts from October 15th through December 7th, almost smack dab in the middle of it. And this is a time where we see a lot of marketing activity, not just by agents such as ourselves, but as many people are aware, there's a whole bunch of advertisement on television as well. And some of that is a bit confusing or a bit misleading. So our role in determining how people comprehend what benefits are part of one plan is a huge difference maker. And that's why they need us. Joe Namath, Joe Theismann, Danny Glover, Kelsey Grammer, the guy that played Mr. Peterman on friggin' Seinfeld. They're all out there sawing their own logs, in a manner of speaking. We need to be there to help people differentiate between the plans and not just the benefits. The other enrollment periods, we're well aware of what they are, but much of what we do during this time period will set us up for the rest of the year as well, because you have those special election periods. There's a whole number of them. And then, of course, Mother Nature helps with adding even more because of different circumstances. Much of what we do now can really help us be aware of what we can do in the future because, hey, another Kaiser Family Foundation piece that came out, it used to be a little less than this, but 7 out of 10 Medicare beneficiaries didn't compare their plans during the last amount of detail that was available. So our being there to help even the more critically necessary people, the ones that are most susceptible to different cost increases, can be a great difference. This, once again, not only during the people we can reach during AEP, but throughout the year. Many of these folks have those special election periods, and many of them are brought on by the programs that we discussed today. So, knowing the differences in Medicare prescription drug plans or the embedded drug benefit within an MA program can make a huge difference because the plans they have now, well, they may not have reviewed it. So plans can change, needs can change. We need to make certain that regardless of what's going on, if they don't have some of these assistance programs and they qualify for them, that creates a great opportunity for us. Now, because not everyone speaks to these programs, you can go in and enhance things, or in the future as well. And we want to make certain that we follow that duty that we have to the population we serve because they're not using the information that's out there by the government. That app, gee, yeah, some of them may use it, not a lot of them. They're not even accessing some of the recorded material the government puts out there to help them with information about saving money on different costs. And that goes through different types of plans, different types of recordings, all the pieces that are out there that we can have available because we know what those numbers are and how it affects these folks that are of lower income. And that gives us then an opportunity to also delve into the dual special needs programs that are really becoming an active battlefield, in a manner of speaking, between the different Medicare Advantage programs that are out there, the carriers extending the footprint of these plans. So having this information and making certain that we can deliver it in a manner that the folks are going to look at and actually review and go through some of these details with us as an advisor, we need to make certain we have the tools to do that either in person or virtually. And you'll see how some of that can come about for you. The virtual presentations, you might say, oh man, they don't do that. Well, yeah, there's a larger number of seniors that are becoming increasingly digitally savvy, as this says. And we have to realize that, gee, for almost 2 years now, they're being trained to receive information like that. They've gone to doctor appointments, primary care and specialists virtually. Same information is being accrued through hospital outreach for different stays there. The pharmacists are using some of this information. All levels of healthcare delivery have adapted to the situation, and much of this is really, really clearing up some of the challenges this population's had in the past because they now comprehend it a bit better. It makes some things easier for them, believe it or not, by capturing this information, speed up the process, clean up a whole bunch of the information that's out there for them. Hey, even faith-based organizations are offering services online. So folks are more apt to take the information and apply it, be it they receive it in the old tactile paper forms or even with um, electronic communications. Sorry, my brain went dead there for a minute. So as we speak today about the opportunities within LIS and MSP, we need to make certain that first we're talking about these programs with a definition of that acronym, low income subsidy. Most folks will refer to this program as extra help. The MSP programs, the Medicare Savings programs, take that a step further and go beyond drug plan and drug benefit cost to medical cost and premiums there as well. So as we look at these programs, we're seeing an opportunity to maximize plan benefits, regardless of what plan they're currently on. It then also helps us minimize some of the costs that are associated with that program, but it also creates that special election period. A couple of years ago, that changed. It used to be monthly. Now it's quarterly for the first 3 quarters of the calendar year. with the fourth quarter, like what we're in right now, being part of the open enrollment period. It affects the cost of the plan, any applicable copays, coinsurance, or coverage gap, and possibly even the catastrophic coverage costs. So this gives us an opportunity to drive down drug costs for these folks with either program. It can also affect any previous enrollment penalties they had in play because of late enrollment or for whatever other reason. It is important to note that this deals with costs, not how the plan is set up. So if they're on a program currently that helps them with their medications, either a standalone Part D or that integrated drug benefit in the MAPD, prescription drug part, it doesn't affect the plan formulary. So it doesn't add drugs to the list that are available under that plan. It doesn't affect any step therapy or quantity limits the plan may have in play. And that is one of the things then that we can go back and look at now or in the future as to how we can make certain that their plan selection best fits their current circumstances. Gives us then a way to increase our prospect pool. One of the things that we have to take in mind and keep in our head is the fact that you're doing the best for your clients. You're making it harder for anyone to replace the programs that you have in play because you've worked with the folks to maximize the benefit. Even if it's a plan you've had in the household, overlaying these programs can really enhance that program because it drives down the cost. And of course, that SEP is there to be used in the first 3 quarters should you need to do so. It gives us an opportunity to manage our time because these folks do have that SEP throughout the year, but we can deliver a lot of the information electronically and help people with the shopping portion of this now. You'll find that if you utilize these programs as well, it really increases the likelihood of referrals. And part of that is due to the fact we tend to hang out with a lot of people like ourselves. So if you have someone who's qualifying for these programs, they probably know others that qualify for these programs. And as you are demonstrating that you're saving them dollars, increasing their benefits, they're more likely to tell other people about you and have them call you. It is also a portion of the population that has a different mindset than the full dual beneficiary, the folks that have Medicare and Medicaid. Those folks in many cases are accustomed to having full coverage in a lot of the areas. These folks may not even be aware of the fact that they qualify for extra help and are more willing to work with you. And in many circumstances, since they're at the higher end of the low income scale, they may have the opportunity to purchase additional programs from you as well. So when you look at the Medicare savings programs, which we're going to spend just a little bit of time on, this is an opportunity to help anyone with Medicare Parts A and B that can work to switch to a Part C program, the Medicare Advantage plans. These do affect the plan premium specific to the medical and prescription benefit and the plan premium penalty if they didn't enroll in different programs when first eligible, and the government's got that 1% per month on the drugs or 10% per year on Part B or whatever it is, it can help in that area. And if it's a fully activated or a person who qualifies for at least QMB, dual special needs plans can be brought into play to offer even more benefits in this arena. It does affect those costs. Once again, the medical and RX copays, the coinsurance, the coverage gap, it doesn't once again affect the plan formulary, step therapy, or quantity limits. So the design of the plan isn't affected, the costs are. Excuse me. So when we look at that low income subsidy extra help program, it does help with access to prescription drug coverage. And we see now in many of the PDP programs or MAPD programs, a larger number of different levels of assistance, and this can really help squash the cost on those different levels. It protects people from the donut hole. It waives that late enrollment penalty for Part D. It creates that special election period once again. And By applying for this, it also triggers an application for the MSP program to see if they qualify for even more help. Now, keep in mind, these Medicare savings programs go up to 135% of federal poverty level, where LIS goes up to 150. So qualifying for LIS doesn't necessarily mean they're going to get the MSP. It's just that in many cases, it will trigger that process to help people if they qualify. To get this assistance, folks must have Medicare Part A and or Part B. They got to live in the United States, the 50 states or District of Columbia, and they've got to fit different financial eligibility criteria, an income test and an assets test. These folks also may have deemed LIS coverage where they get it automatically because they have another needs-based program. That includes the MSP program or Medicaid assistance. And these groups don't have to qualify for LIS because they get it automatically with the MSP program. And generally, that assistance works for the remainder of the year because the qualifying factors for this does change annually. We have seen recently that Social Security increases 5.7%, which is the largest in a long time. That may be enough for some of the folks that borderline qualified in the past may not qualify next year because their income is above the limits. So it's a thing we need to be aware of when we speak to those different types of assistance. It gives us an opportunity that if someone is in one of the very inexpensive Part D programs that have the deductible, well, it's going to take care of that for the folks that are fully qualified. It'll help with that initial coverage limit. It will help with the out-of-pocket threshold. It will help with all of the spending that is there within the gap of these programs. The donut hole may be quasi-closed, but it's still an area where people need assistance. It is also an area where we can kind of surmise if these people have this assistance now simply by the standardization of some of the copays they may be subjected to even with this extra program. Now you have a ton of carriers out there now that have online or telephonic assistance to help you understand what level of coverage a person has. But these are pretty good clues that someone's on one of these programs, the assistance program for their medication. It's also important to note that there are standards set for benchmarks as to premium where LIS covers the entire cost of the plan. So the premium itself. So it's that average that can vary by state that tells you what the person's going to have to pay for the plan itself. In many cases, it's fully subsidized. In some cases, if the benefits supplied by their current medication coverage in either type of possibility is above that threshold, they are liable for that premium above that benchmark amount. You'll see that in many cases, if you work in the MAPD portion, they may carve out cost for prescription drugs. Most of the time, those are well below that threshold, so you don't see it as much on that side, but you can see it if people chose not to make a choice, qualified for a prescription drug plan, were auto-enrolled by the government in one plan or another. We need to make certain that they are in the plan that best suits them, not just for the premium of the plan itself, but also for the benefits that it provides. Formulary, are there drugs on it? Those different things that can come into play and can really enhance their situation beyond just the assistance program. So as I mentioned, if the plan is above the premium, that is the benchmark, they're liable for it. These benchmarks do change each and every year. Information is available from the government. And we also have to take into account that as a person gets on a drug program, well, the drug may remain in the formulary, but it might have changed tiers. And that then gives us the need to investigate their prescriptions at least annually, because that can be a big difference in their out-of-pocket costs. And we're seeing some of the plans drugs, the costs are changing even though the drug didn't. So we have a number of reasons to fully investigate the use of medications within our prospect or client database because, hey, things change. What's the old expression? The only constant is change. Well, that's what it really comes into play with prescription benefits. So you're going to get people assistance once again on the cost of the plan, affects the deductibles, and you will see that the co-payments are standardized. It really maximizes the plan benefits. It can minimize some of the plan choice and costs because we want to make certain still that the formulary is best suited for that individual so we can affect those costs and once again increase our prospect pool. Talked about this a bit ago already, where the special enrollment period changed a couple of years ago for people in these categories, where it went quarterly instead of monthly. Now it's kind of a moot point since we're in open enrollment. We're dealing with everyone, but that gives us an opportunity down the road to address challenges where a person in June may call us and say, hey, they changed drugs on me. This is more expensive on my plan. I do get that help that you helped me with, that low end, that extra help program, but my medications are different. Can you help me? Well, you've created a SEP. You can keep that person within the fold. LIS does have two levels of help. The folks that are fully subsidized, these are the people that are of the lower income and fewer resources, and people that receive partial help. So as I mentioned before, the Medicare Savings Plans go up to 135% of federal poverty level. LIS goes up to 150% of federal poverty level. That 15% difference may well be the portion where they are partially subsidized. Still makes a big help. It eliminates the Part D coverage gap and that late enrollment penalty should they be there. But full subsidized programs takes care of the deductible, takes care of the premium, minimizes those co-payments, and minimizes the co-pays if they reach the catastrophic limit. The folks that are really heavy medication utilizers. The partials, well, it could be a sliding scale premium based on their income. It may have a small deductible, may have different types of co-insurance that's on there, still standardizes those co-pays. But this is a good indicator for you that that person selected their drug plan based just on the cost of the plan. Didn't do an evaluation of the medications that are on there. For some folks, they might have taken the least expensive plan because they don't use meds. Not too often for many people on Medicare. So we want to make certain that we evaluate the plan choice once again. This gives you some idea as to the sliding scale of the folks out of pocket. So as I mentioned, once we get above that 135% of federal poverty level, that is an upper limit for an MSP, for a Medicare Savings Plan, those costs drift up for this population. These are numbers taken from the National Council on Aging that gives you that detail for each of the states in which you operate, either full subsidy or partial subsidy. And you'll note that these tables are for the continental United States, excludes Hawaii and Alaska, but includes the District of Columbia. And it'll tell you what those income levels are, what the person pays as well. This is some of the information that's available to you by this link, so you can have this detail, the chart itself. I'm finding that as I send out information with multiple attachments, we're getting screened by many of the spam filters. I want you, of course, to mark us as safe on your email, but sometimes this will get caught up in your spam filter. You have also that information for the folks who work in Alaska and in Hawaii. Those numbers are higher, income numbers are higher for them to still qualify for assistance. So they can actually apply for this help a number of different ways. Go online and do it, or do it during paper, using paper. And everything in our industry is going to electronic means. The paper process slows things down. There can be things that are submitted in that manner that aren't complete. You can actually help people by going into the Social Security website, act as an advocate on their behalf compliantly, and help them with this application process. It is fairly timely in its turnaround. The application filled up in line online, well, you can't submit it without it being complete. So it will process much more quickly online. You also have the benefits checkup program that is actually given to us by the government, um, but many of the carriers help subsidize that program for their organization as well. One of the carriers actually has their own that helps people qualify for these programs. So you have ways out there of helping people that if you have those numbers and you realize that they probably qualify for additional assistance, you can't guarantee it. You're not the one saying, hey, you're going to get this. It is an opportunity to apply for a program that can help them that's determined by the government. Make certain that you don't set yourself up as, well, I can get this program for you when you can't necessarily. You're filling out an application. You can't guarantee to qualify. It's amazing how people squirrel money sometimes, particularly in that age demographic, and they don't tell you about it or whatever. The government will find out. So again, online's quicker, easier, faster. It doesn't require verifying documents. The government's going to use federal records to verify the answers. The paper form's getting complete. It's going to slow down. The government's going to follow up eventually by phone with the applicant. The online application cannot be submitted until it's complete. Much like the applications for coverage that we deal with all the time. Well, hey, same thing here. It's got to be done before the system accepts it. These instruction sheets for this are available in multiple languages, 15 languages on the Social Security Administration's website. So people in different ethnic opportunities, well, you have the information in there so they can understand what is going on with it as well. And once again, when people are deemed eligible for low income subsidy, because of other assistance programs, they don't need to do this process if they already have it in place. This is how the programs look, online or paper. There are a number of agents that will actually pick up and draw the information on one of these paper applications and submit it later for the individual to make certain that their schedule is adhered to, and they can do that compliantly as an advocate and do it later. Basically telling people that you're gathering the information. We want to make certain that we can apply for this. You don't approve or deny it, but you want to put in the information to see if you can't get them as much benefit as possible. Now, it's important, since this has a ton of personal information on it, that as we enter the information, this is stored where it's safe, or we destroy it, shred it, so we can protect both the client and ourselves. They'll get that letter telling them that they're approved or denied within a couple, 2-3 weeks. And it looks like that. Once they have that, if they have a future effective date on a plan, it's going to come about when that plan is effective. If they're already on a program and we're doing this at a different time of year, it kicks in the next month. So you have a number of resources that can help you with low income subsidy, a great way to acquaint yourself with the intricacies of these programs. Do you have to be an expert in this to do this and help people? Oh, no. You have to have the strength in your heart and a bit of a point of nudging with your wallet as well, your purse, whatever it happens to be, to make certain that we're doing everything to help our people. And utilizing all this information can be helpful for you. It's even got a link to that online application. So different materials being made for you. Keep in mind, these links in this presentation will come to you, and you can utilize them to get that information that you need that may not be part of the follow-up. We're going to attempt to have as many links active in the email follow-up as possible. It's just we want to make certain that you have access to them at any time. This is one of the programs or one of the presentations that's made available to us from the National Council on Aging that you can personalize with your information, much as what I've done here on this particular slide, to help you with a presentation to the public if you're doing seminars or webinars. So this is a great piece to use throughout the year. Now keep in mind, come next February or March or so, we're going to have to update this presentation and the numbers because they're going to change. But it rolls through the presentation itself. It sets up the agenda that you want to use. It is a piece that we would modify with the public because we don't necessarily want this category out there. We would change how this is titled and how it is labeled within the presentation itself. It gives them the information as to why this help is important to them. It gives them the information about the people that are involved in the process, where it is the government that handles the application and eligibility, not us. We're just facilitating the process, and gives them the information about the general eligibility rules. It speaks to those two levels of help that we talked about, how the difference is for full subsidy, and the numbers that are involved, the partial subsidy, and the numbers that are involved, and what is part of the income test and what is excluded. It also speaks to what counts as resources and what is excluded. It speaks to how a person applies. So you're walking people through the process so they are comfortable with the possibilities they have for help through these programs. How to make certain that we can do things in a timely fashion, and how it can affect additional help if they qualify. This is a section here that is important for us to realize how we can handle our clients once they qualify. This is a section that if we're delivering this to the public, we're going to change how this is titled, and I'll work through the circumstances that are involved with it. It speaks to all the detail that we know about these programs and how it's important that the client understands what they're getting into and how they then have additional resources that are made available to them, and gives them much the information as what we're talking about earlier with what is involved with our study on it. When you provide this sort of detail, it gives the person the opportunity to verify for themselves that, hey, this is actually there. This is something I can qualify for. This can make a difference. And it's kind of that third party, hey, I'm giving you the information. Here's how you can prove it for yourself. It's a fairly short presentation, 22 slides, and this will be sent to you in a presentation format, altered, that you can use to personalize yourself and go through based on it. I'm not going to go through this in a true presentation type of fashion because I got another one of these to go through as well, but it will be recorded and will be one of the links that is part of the follow-up to today's presentation. When we speak to the Medicare Savings programs, the additional help of it, keep in mind what we've been talking about with low income subsidy, that affects the prescription benefit with the monies that are involved, the cost of the plan. It deals just with medications. When we speak to Medicare Savings programs, we're talking about an opportunity for folks that are in a Medicare Advantage prescription drug program to see the cost of their medications within that plan affected by low income subsidy as well. So, in some of the more recent data we have with MAPD plans, we've got, over a quarter of the folks in an MAPD plan can qualify for LIS. Well, they do. And it then can make a big difference as to how we're squeezing down the cost within an MAPD program as well. And when you look at the folks that are in a Medicare Savings Program, there's almost 9 million of them, and a significant number of those folks that are eligible don't have it in play. We can really make a difference because this enrollment rate will vary greatly state to state. And for many of the states in which we operate, including some of the more populated states, there's people out there that qualify for this that don't have it. So if you're able to help people get in this program, become aware of what it takes to become eligible, you have created a marketing monster of sorts as well. Because as you help them, they're going to talk to other people about you. They'll say, Agent Jane Smith really helped me drive down my cost across the board. You need to talk to her. Here's her phone number. So it really helps you in that regard. These are programs that are Medicaid administered, conjunction of the state and the federal government, and it involves, by the different levels of qualification, a means to handle not only the cost of programs themselves, but the Medicare premiums and cost sharing that these people may be subjected to. So the Part B premium can come into play. And in certain circumstances, even Medicare Part A, where a person had to buy into Medicare for one reason or another. Different levels, well, I talked about 4 of them. We run into 3 most commonly, so we spend most time on these. And these are the QMBs, the Qualified Medicare Beneficiary QMB people. It's the oldest of these programs. Gee, we're now 33 years into it, but you got a good portion of the folks that qualify for these don't have it. You can really help them. You have the SLIMBs, the Specified Low Income Medicare Beneficiaries, SLMBs. Even a larger portion of this population isn't enrolled in it, and much as the Qualified Individual 1, the QI1. These 2 later programs take care of the Part B premium. They don't help with some of the co-payments or deductibles and co-insurance that a person would have with just traditional Medicare. When you talk about QMBs, then you're talking about a different animal. To be eligible for these programs, they got to have Medicare Part A. They got to fit those income and assets tests. And you'll find that certain states don't have an assets test. That can make a big difference as to the number of people that qualify. And for folks that move from one of these states to a state that does have an asset test, it may remove them from being qualified for that assistance. These are applications that are standardly submitted through local Medicaid offices, many cases located within a Social Security office. And remember, this application process is started if someone has put in for LIS as well. If you do it that way, it's going to take a little more time. So we need to be aware of things we can do to kind of push the application through much more quickly. These 2 are redetermined each year. You have then a waiving of the Part B late enrollment period, in addition to any late enrollment period with their medications, because remember, they get that LIS automatically. It will qualify them to waive the penalty for that, and it's not subject to estate recovery. So when we look at these, it's not like putting someone on Medicaid for long-term care, a different animal. The folks that qualify for an MSP, once again, automatically get that low income subsidy. And keep in mind, since each of these 3 programs that we talk about go up to 135% of federal poverty level, that LIS assistance is fully qualified, not a partial qualifier. You got the game players here. Who determines what, how this comes into play, and which government entities are part of this process for determining eligibility and then oversight thereafter. You have this same sort of information made available to you from the National Council on Aging, and you'll get these along with the link that tells you what the income is in order to be fully qualified for the different levels all the way through. That's that 4th level, the qualified disabled working individual. Doing this for over 25 years, I think in that entire period, I've run across 3 of those folks. I never ran into them much. The other ones, it's just by asking that old Columbo question. Hey, by the way, your income below this level, and are your assets below this? Because if they are, we may be able to get you additional assistance. It also tells us where these people are and who determines it within the states in which you operate. So this can be helpful for you to give you an idea as to what's the monthly income layer out there, and then are there assets tests that are involved. So you have that there. That will help you. The MSP excluded assets, it's one house and one car. Doesn't matter the value of either. They have multiple houses, then you got a challenge because you got an asset that may knock them out. If they have multiple cars and they run and they work, well, that might knock them out. What we see in many cases for folks that may be beyond the assets test, they'll use some of those dollars to improve their home, and then that may take down the assets they have available, even though it really improves their house. You've done that legally in that advice. Same thing with cars. If the car's up on blocks in the driveway, they can use some money to actually fix the car, trade it in, whatever it happens to be, because that car and that house are excluded. You also have in certain areas the dual program that the government has in play in certain states that is a test program that can really change some things for the folks that are fully qualified. So, for example, in Texas, this is called the Star Plus program. It's a dual demonstration program that is fully implemented in the major population centers. For your states, if you work outside of Texas, we need to make certain that you have this information so you can fully understand how managed care within Medicaid works. We went through all these programs. We talked about, the number of people that qualify but that aren't in them. Why is that the case? Well, they may not know about it, or they may have tried to get it in, thought it was too complicated, abandoned the enroll or the application process, or they had someone that was going to help them and it was too hard to get there for them to help them. And then, of course, you're dealing with a proud generation that associates this in a misplaced social stigma where I'm on the government dole, I'm on welfare, don't want this. These entitlement programs are something that if we speak to them correctly, that's why I keep bouncing back from low income subsidy extra help. People will respond to extra help a little more easily than labeling them low income. So knowing how to speak to our folks and how we can address why they don't have it in play can really make a difference. So much as what we could do with low income subsidy and go to the Social Security website and help them get this coverage. If you're working with, well, United Healthcare has their My Advocate program, any of the other programs such as Anthem, Centene, gee, I'm missing people. I know Aetna, a whole number of other companies. Humana uses their version of benefits checkup to do this. So you can really help people with this application process as well. If they fully qualify for the underlying benefits of these programs, it may help them qualify for a dual special needs plan. And I know many people aren't as active in that area as others, but if you run into someone who has QMB coverage or greater assistance even than that, it will help them qualify fully for a dual special needs plan, which can make a big difference to them when it comes to the benefits that are available to them. You might look at this slide and go, gee, John, you get that slide in there that should have been taken out a year ago. ESRD, well, we can put people on Medicare in a Medicare Advantage plan for that now. Well, depending upon the dual SNP, not necessarily. So we need to make certain we know what we're talking about when it comes to eligibility based on that one health circumstances with the plans that we are presenting. If you have folks that are on a Medigap policy and they qualify for MSP assistance, well, keep in mind that MSP is taking care of the cost, and Quimby should not be sold a Medigap policy. They can go stay on just Medicare and QMB, and they don't have to go in an MA program, but they don't need the Medigap program. We need to make certain we realize that. If someone has SLIMB or QI coverage, keep in mind this is paying just for their Part B premium, not any other medical cost. If they have a Medigap policy, it is then a help for them to defer some of the costs of that premium that they're paying for the med sup. So this can actually help them in that area if they are already on one. Is a really big factor for many folks because it helps them to continue to afford that plan. When we speak about some of the things that people have if they go in a nursing home, well, that's a different animal. So we need to talk about that in a different presentation. You have all the resources here that are available. You got those community tools that are available. And once again, you have a program that you can use to explain this. So these two PowerPoints are similar in nature as to how they're set up. They go through the specifics. And once again, these are what we can use in a very short presentation with the public, making certain that we are relaying the information as it lays out here with the guidelines and the costs that are available, what it takes to qualify, those sorts of things, how we can make a difference for these people. The LIS presentation was 22 slides. This one's 20. So they're fairly short. I'm not going through them now since I'm almost up to the top of my time period as it is, But this will be made available to you as well as the LIS version. You can modify it and personalize it with your information instead of that mug that can make a difference for your dartboard with your contact information. You can use this throughout the year. You can be the subject matter expert, get into locations on a generic basis with this. It's not labeled by any carrier. Each carrier probably has the same information as well. I know a number of them do. This you're taking from the National Council on Aging. It can make a huge difference as to how that's perceived. You're disseminating information. You're not selling in this circumstance. It creates a selling opportunity, but perceived much differently there. So keep in mind, both of these presentations will be recorded in a manner in which you would present them to the community. So a change of those titles on a couple of those slides, so it's more comfortable to deal with the population in the community that you're addressing. What we look to do with this information is add to it with our expertise from Premier Marketing and some of the other programs that you can use to help enhance your product portfolio, the numbers of programs that are out there that you can help people with specific needs. And we have electronic means to help you with that contracting process through SuranceBay. You create an agent profile in there, you can add to different programs that can address specific needs. This is particularly helpful when you're looking at a number of different ancillary programs. Some of the MA programs or mid-sup programs, we're sending an electronic link with that so we can speed it up. We do offer discounted errors and admissions coverage for qualified agents. What makes you a qualified agent? You have a contract with us. But this isn't like just being added to a blanket policy for one program. This covers you across the board. You own it, and it satisfies the requirement that just about every insurance company has there for your own version of malpractice insurance, in a manner of speaking. Good premiums that come into play on it, a great protection for you. We also offer bundled continuing education programs available for you through our association with WebCE. So we help you keep your license in play as well. And you can add to your own benefit package by utilizing a modified guarantee issue DI policy for yourself that's discounted, and you're paid a commission on it. Much as where today's presentation is being recorded, you have access to it on our website and on our YouTube channel, but also gives you the opportunity then to view different concepts across the board whenever you have time to access them. They're available to you 24/7. So we go through and we talk about LIS and MSP. Well, look at how you can market within the community or through faith-based organizations utilizing these as topics to get in front of that audience. We also have that tool we cannot talk too much about, and that's the Medicare Center program that's available without cost to our agents with a single login, access to 3 quoting engines, Medicare App, Medicare Link, and CSG. So you've got Connect Your Sunfire and CSG. It gives you the opportunity to collect those scopes of appointments by multiple means, and a CRM and a resource tool in there to help you become comfortable with and maximize your time utilizing a program that keeps you compliant. While Medicare Advantage programs and prescription drug plans don't have other bonus programs, so to speak, many of the ancillary benefits do. And so we have a spot on our website that speaks to these incentives, how they may help you qualify for carrier trips, and different incentive programs that we have at Premier as well. Means of getting you in front of people. You can't call for MA or PDP, but you sure can for med sup or dental programs. So we have contact lists that are made available to you at low or no cost. We have those programs, as I mentioned, recorded that helps you access community-based marketing programs to get you in front of people in your target market. When you deal with MA and PD programs and you are in a symbiotic relationship with that carrier, they're scratching your back, you're scratching theirs, you may well be in line for prospects generated by that carrier as well. That's where it is so important for you to have a good relationship with your carrier agent manager because they control that flow. We do have internet lead and direct mail support and a neat referral program to help you take one lead into multiples just by following certain steps. That lead program for direct mail, based on production, drives down the cost so you can do it consistently. You can qualify for it through both health programs and final expense. So you can have two different mail support programs going at the same time. We work through vetted preferred lead vendors to make certain we're protecting you with compliance. Each of these companies are really good about their CRM systems, so you can catch that response as soon as it comes in, hot as it can be. We also have a couple of programs that can help you with just the responses. You're doing a mail program by yourself. It takes a little time for it to be created, sent out, returned. With these, you're dealing with just the returns. They've never been touched, and the cost is minimal considering the return that you can have on these as you close them, but they aren't quite as fresh because you're not getting them immediately, and the cost can and do vary from area to area and plan to plan. That internet lead program is through Facebook. We have one set up for both final expense and Medicare. And once again, that referral program is not just for the folks that you're selling now, but engaging your current book of business too. So as you look at these different programs and the value that they bring to you as an agent and to your book of business and prospect possibilities, this is something that you can implement immediately. Become comfortable with it. Use some of the information, or use the information we're going to be sending you as part of the follow-up, and that you can access online, and put it in play immediately. We talk about this because we think it's a great way for you to grow your business, and we want your business as well. So we're asking for that. We're asking for you to refer other people to us as well. So it's a circumstance where we're going to be reaching out to you. We've got some questions here. Bear with me a moment. No, we just got a nice compliment. Is there a benefit of an PDP versus an MAPD? You bet there is. Sometimes an MAPD program may not be the best choice for an individual, but they still need drug coverage. The terms of the assistance through LIS is the same on the drug benefit, either way they're accessing it, but we have to look at what is the best overall solution, or is perceived as the best overall solution for the person that we're visiting with. This webinar will be emailed to attendees, and that's what we've got for questions here today. So I want to thank you for investing your most precious commodity with us here today. We're just under an hour. You can reach us at our toll-free number at 1-800-365-8208, through our website at premiersmi.com. If you're dealing with a marketer within Premier, they're going to help you with this. If you haven't dealt with Premier in the past, well, we're going to set you up with a subject matter expert to help you. And of course, you can respond to the email as well, and I'll make certain that we get you with a person that can help you with these programs. All that said and done, for those of you that have worked with us in the past, I thank you for your business. For those of you that are looking to work with us in the future, I thank you for that possibility as well. And I thank you for the efforts you put out to project and protect, I should say, the community we serve, the Medicare beneficiaries, and in sometimes the most vulnerable of the folks that we visit with. So all that said and done, until we're able to speak with you again, I wish you good selling. Thanks so very much, and we'll talk to you very soon.